It is absolutely uncanny. She sat down for her butt no more than touched the chair, and she found a four-leaf clover. Like a second, half a
Just it.
second. Anyway, where you at? You need to scoot in. You're not on there. Anyway, thought today we would talk about the top 10 most Googled health questions of 2019 and add our little tidbits to it. Talk about some of the experiences that Jessica's actually been having in the IV lounge, and we will go from there. So let's look at question number one: how to lower blood pressure. And it's actually pretty amazing that on how to lower blood pressure, Jessica has a little case study, some anecdote on this.
Well, it's not really a study, but I do have a patient of mine that she gets an IV every month. Probably has for probably 6 months. I think she actually has done it as long as I've been doing it. And she started out with her blood pressures, 160s, and every month her blood pressure has dropped. But she says the only thing that she's done, son's a killer, um, is well, she does her supplements, but she hasn't done anything like she hasn't changed a lot of her diet, and she hasn't changed her exercise. The only thing that she has changed is she's done the nutrient micronutrient IV one time a month. So she went from high 160s. So then I started going back through her chart. Then she was 150, she was 140. So the last time I took it, it was like 127 over 70 something. And she had me to take it again just to make sure that I was right. And was so excited that she wanted to go home and take it again just to see if her said it.
And then I think she went home. Didn't she come back on the next Wednesday and say that it was the same on her blood pressure cuff as well?
I think so.
So, so some interesting things. What are things that can cause high blood pressure? Well, your vessels can be being constricted, they can be getting hard. It's uncanny. She can find those things anywhere. But getting back to that, nitric oxide is one of the things that they have used for blood pressure. And they also used uh, bonita fish peptide. If Libby wouldn't graze like a cow, she wouldn't hack up stuff. Um, but it's very interesting how there are tons of natural stuff that you can eat. I mean, why would you take bonita fish peptide from Metagenics? That's what we use. When you could go make fish tacos and you're just layering in health at that point in time. And I get it that it's simpler sometimes, but just eating whole foods, diverse foods, and a variety of foods, typically and fiber, typically tends to help this. Controlling your homocysteine levels, omega 3 fatty acids, fiber, nitric oxide. And then, of course, when you look at the Googled answer, they talk about all kinds of beta blockers and sodium intake and this, that, and the other. The latest studies on sodium intake show that the kidneys, unless you have kidney damage, you really don't have to worry about the sodium. But it still has been around so long that they still follow that.
Well, and if you eat too much sodium, because most people get way too much sodium in their diet, it actually causes you to retain water, which is what actually drives up your blood pressure.
And so next, which leads back to the kidneys, because your kidneys excrete the water. The second most asked question, maybe I should have done this as a countdown. What is keto? And so, what's the ketogenic diet?
What specifically is it?
It just says, what is keto?
Well,
That's
like
what
the
they're
fifth grade
Googling.
level, it's very limited sugars or natural sugars in your vegetables. high protein, high fat diet.
It's especially high fat. You want to limit a ketogenic diet is actually defined as 20 grams or less of carbs. Your fats are generally, you're looking at about 10% carbs, you're looking at about 60% fats, and you're looking at about 30% protein. And you can monkey with the protein and the fat. It was originally used to control seizures. We now use it. I mean, it's a great tool. Don't get me wrong. Fabulous tool for controlling insulin. But once again, as you've heard us both say and
Don't
talk
live
about,
there.
yes, do not live on the ketogenic diet. It absolutely mucks up the microbiome. Now, you can be eating a ketogenic diet and getting enough fiber that you still produce ketones. I should say you can eat a varied diet. We both eat a very varied diet, high in fiber, about 40 grams at least a day. You would not believe the amount of fruit that I eat in my smoothie. And I still produce ketones at 0.3 to 0.5, depending on when I test. They're always there. And that's just because it's a healthy, diverse diet. Now, I do practice intermittent or time restricted feeding, as does Jessica. And that just helps. That gives the body a break so it's not constantly working. So that was number 2. This one I thought was kind of cute. How do you get rid of the hiccups?
There's really no scientific way because hiccups are your diaphragm spasming. So mostly if you breathe in air, you drink something too cold too fast and it's caused your diaphragm to spasm. But you're supposed to relax. So what would really help it is to just actually relax.
It's
But sugar doesn't work. Holding your breath doesn't work. Sitting upside down doesn't work. A spoonful of sugar doesn't work.
Scaring you doesn't work. So their answers, and this one would actually go along with what Jessica said. Altering the breathing cycle, doing 4-7-8 breathing to calm yourself down, pulling your knees to your chest, possibly gargling ice water or sipping cold water, pulling your tongue. I'm not sure why.
Well, you know why that would work? Because if you were pulling your tongue, you'd be concentrating on that, which would actually create some like what a meditation, because then you'd be focused on something else. So it creates same thing, creates relaxation.
I haven't had the hiccups in so long, but if I get them, I'm definitely trying to pull my tongue. Rubbing the back of your neck. And they also add, it's unclear whether adding the words there makes a difference. Getting scared, nope, didn't work. And laughing spontaneously. Not sure about that.
Well, that would work probably because there's a wasper. You're stretching out the diaphragm and stopping the spasm.
And so, number 4, how long does the flu last?
Truly? Probably truly, like from start to finish, probably 7 to 10 days.
I said 4 to 6 with its peak at 3 to 4.
Well, but it usually starts before you have symptoms and you're still active shedding virus that you can actually give it to other people after your last symptoms.
And so there are also a lot of people. So, let's go back just 1 second. Basically, if you can get through day 3 to 4 and you're not having severe symptoms, you're probably over the hump at that point in time. Probably still not afebrous or afebrile or whatever, but just like most things, just time takes care of it. Number 5, there must.
What was the answer?
If you're wondering about flu symptoms, then the answer is forever if you die from it, which occurs in tens of thousands of people each year alone. And 3 to 7 days. Oh, I guess 4 to 6, 3 to 7. They split the difference on us.
So they said tens of thousands of people die of the flu. Well, they don't necessarily die of the flu. They die of complications from the flu because of their comorbidities. So don't go like all crazy. Oh my gosh, I got the flu, I'm gonna die. it's usually not specifically the flu that kills you.
And that plays right along into the dreaded COVID. It's the cytokine storm is your body's inability to regulate its own immune system. That is not actually COVID. Now, COVID triggers it. COVID is the trigger, but your immune system has the inability, or it can't shut itself off.
And flu is not gut symptoms. Flu is respiratory.
Ooh, you might want to explain that a little bit more.
So the flu virus is a respiratory virus. So people get flu and they vomit or they get diarrhea and they think they have the flu. Well, that's gastrointestinal issues. Could be related to the flu, but flu is sneezing, coughing, mucus secretions. When your lungs get congested, that's flu. Fever, and you get the fever because your lungs get junky. So you need to cough. So don't suppress your cough. You need to cough it up. So if you're not coughing it up, then the bacteria grows and puts you at risk for pneumonia. So it's good to cough.
Hold on, I'm looking up something.
But it is good to take something to thin out the mucus. So drink lots of water, not milk. Milk actually thickens the secretions, just so you know.
All right. A lot of people are getting the hiccups. Number 5 is what causes the hiccups, and she already answered that, the diaphragmatic spasm.
It's caused from sucking air or drinking something too cold.
Here's one near and dear to my heart. Number 6, what causes kidney stones? So,
Lots of factors cause kidney stones.
Well, the 2 types of stones, what they're made out of, is uric acid and
Holy
calcium oxalate.
And dehydration.
So calcium oxalate, you can actually trigger a kidney stone formed of calcium oxalate if you're taking too much vitamin D. I got that one. Haven't had one since. Uric acid, start to think of high insulin, sugar, sodas, beer, those types of things. They also typically tend to raise homocysteine.
Brown colas.
Really?
Brown, it's the substance in brown colas. Whatever makes it brown is what causes stones.
Crap makes it brown. Don't drink crap. What is number 7? What is HPV? Why are they Googling this?
HPV?
Yeah, human papillomavirus. Why are they Googling that?
It's a sexually transmitted disease.
I get that. I mean, it's so prevalent, and generally it self-resolves.
1 in 2 people have it.
Yeah, 50% of people have it. It self-resolves.
But it doesn't necessarily clear itself because a virus will stay dormant in your body. So it will pop up when your immune system gets low. And it can be passed on to your babies even if you aren't active. So children that are born through the birth canal with a mother that has human papillomaviruses, the virus is transferred to them, and then they may not have any symptoms until they're teenagers, and then they start getting warts all over them.
Oh, well, we just had a interesting talking about health and just the cluelessness of people. And I'm not making fun of people. I'm actually pretty upset about this because we have lost a lot of knowledge and just been marketed to. But had a 19-year-old coming in, and this patient is dealing with some issues, and I'm sitting here looking at her intake form, and I happened to ask her, because looks fabulous, no processed foods, no fast food, homemade food daily, and just looks, and phenotypically, to look at this female, she looks like a healthy female. And so, that 5'5", 5'10", or 5'5", 5'6", 110 pounds, thin, svelte. Of course, she's also healthy. 19.
110 pounds is not healthy. at 5'5".
Well,
but it's attractive to the male eye.
so she didn't show any issues with blood pressure or any of the other metrics. Anyway, when talking to her about what is going on with the pain that she's having, and I asked her what she drank, and she goes, "Oh, not enough." And I was like, "Okay, not enough. What does not enough mean?" And she goes, "Well, I have a couple glasses of water a day." So she's getting about 16 ounces of water. And I'm looking at her intake, and her intake doesn't indicate anything else. So then I'm like, "Okay, so what else do you drink?" And she goes, "Oh, I drink Kool-Aid and Gatorade." And I'm just like, so there's not a lot of difference between Kool-Aid and Gatorade. Some Kool-Aids have actually more sugar in them than Coke. And the only thing you're missing is the carbonation. So maybe not as bad because it's not going to form the carbolic acid, but you're just basically drinking colored sugared water. And that is just an insulin spike waiting to happen. So we discussed that, and the diet and everything else looks pretty good. So she's actually quite a conundrum. Hopefully, we'll get to do some testing on her and see what's going on. Number 8, how to lower cholesterol. Well, this one's near and dear to my heart, and actually a lot of my patients, because if your cholesterol is off, your hormones are going to be off. If your cholesterol is off, a primary driver of cholesterol is a form of hypothyroidism. So if you have underactive thyroid, and this, if you do not test TPO and thyroid antibodies, you do not have the complete picture of your thyroid. And just the TSH, T3, T4, free T4 does not count. You are not free and clear until you know those last two components, because those last two components are the components that cause you to throw off your cholesterol and your hormones. But then after that, fiber, vegetarian diet actually gets rid of it pretty easy. So let's see. If you're asking for yourself, you may not want to try the keto diet. Cutting your intake of saturated fats and trans fats is an important step. So is increasing your intake of omega-3 fatty acids and fiber. Getting physical activity, losing weight may help. If you're smoking, stop. Also limit alcohol consumption. High cholesterol can increase your risk of stroke and various types of cardiovascular disease. Well, their first statement, cutting your intake of saturated fats and trans fats, half of that is true. Cut your trans fats. Cut trans fats out. Why trans fats are still in the American diet is absolutely beyond me. Trans fats are just atrocious.
I think they say just cut fat because most Americans don't know the difference.
Well, but you and I both know that the avocados and the nuts and seeds, that stuff is great. And
we know that, but the like a 5th grade level, they don't know that.
Gotcha.
Fat is fat.
Fat is not fat.
But fat is not fat. There's healthy fats.
Number 9, how many calories should I eat a day? Hopefully the group of people that we are talking to knows the difference. Do you all know that the calories really don't count? It's the quality of the calorie. I hope we have educated you guys enough and said this over and over and over enough that y'all get that. So, they're going back to the answer is more than one per day on average. How many calories? Oh, somebody was being cute. More than one per day on average. You need calories to survive. However, people are probably wondering how many calories they should eat based on whether they want to gain weight, lose weight, or neither. Frequently cited threshold is 2,000 calories for women, 2,500 calories for men per day to maintain. However, this greatly oversimplifies the complexities of the body. I am very happy that he recognizes that. The calorie that you need depends heavily, no pun intended, on many factors, including your size, age, and activity level. If Pierre Phelps, for example, you can probably consume a lot more calories than Michael Scott, the actor on the television show The Office. The Mifflin St. Jewer equation, which has nothing to do with the Dunder Mifflin Company of The Office, does take into account differences in age, sex, and weight. People, calorie, it's the quality of the calorie. Would you rather drive a Yugo or a Jeep?
Maybe.
Would you rather be on a broke down old scooter or in a caddy? It's the quality of the calorie. The quality of the calorie is what affects the insulin. A calorie of Snickers is going to raise your insulin. A calorie of broccoli, not going to. How long does alcohol stay in your system?
I don't know. I've never drank. Not enough to care about that.
You're a nurse. How long does it take those guys
that depends. Because that's the health of your liver and yourself, because a person that's in liver failure is not going to detox. So we may have them vented for a week, and somebody else may blow it off in 24 hours if they're young and healthy and they've never done that before. So that is not something that has one answer. That's the health of your liver and how quickly you can detox.
How tolerant you are. Basically, it says the speed at which you break down brown alcohol depends on all things: how big, your age, metabolism, and general health. But a general rule of thumb is half a drink per hour.
But if you're a heavy drinker, do not stop drinking cold turkey. You will wake up later on a vent somewhere. Well, you laugh about that. So they always wanted to know why. Just a little nugget for the day. During the pandemic, the liquor stores were considered a what do they call, like,
essential.
And everybody's like, well, liquor stores aren't essential. They're absolutely essential, because if you have alcoholics, and lots of people are alcoholics and they don't consider themselves alcoholics, but if you need to drink a drink every day, you are an alcoholic. And if you do not get that drink every day, you will detox. And depending on how many drinks you actually drink every day is how quickly and hard you do detox. And people think, I'm going to do good and I'm just going to stop drinking, and you cannot do that, because you will have a seizure.
Interesting tidbit. Did you know that your chickens that you get that are conventionally raised, learned this little tidbit. Thank you, Kathy. The chickens that are conventionally raised, their chicken feed actually contains arsenic. That was a little tidbit that I learned that I did not know.
And we still have to figure out why it's added.
And then last little kind of interesting quote of the day before we wrap up here. Voltaire was a old guy, a philosopher, something. And he said the art of medicine is for the doctor to entertain the patient while the body does the healing. And that is absolutely true. Modern medicine assumes that the body wants to break down and that the body doesn't have the capacity to heal. And in the modern environment, it doesn't. But if you can start to give it things like micronutrient IVs, or you grow your own food so everything is organic and from the earth and has good soil that it can pull nutrients from. If all of these things are there, you don't need to buy vitamins and you don't need all of these other things. But until we can actually get our farmers and those people that are in charge of our food system to worry about the quality of food,
which means they're nutrient dense.
you're going to have hard times, and that's why we do nutrient IVs. We put people on supplements. We put people on digestive aids. These things are all very, very important to life. I had an older gentleman come in, and we were discussing his health, and he was giving me the pill for an ill situation. I'm taking this for that and this for that, and I've got to be on these things. And I was like, well, let me ask you a few questions. If you cut yourself, do you still heal? And he's like, yeah. And I go, okay. If you get a headache, do you usually get over it in a day or two? Yeah. And I was like, why wouldn't you think the rest of the body would also want to get well and heal? And the paradigm that we have been fed for so long is your body can't do it. And that's absolutely wrong. Your body can't. And we're here to help you heal from the inside out.
Yeah, I have a little tidbit because I had this worked for a surgeon that I just absolutely adored. And his way of deciding whether or not you had enough extra or you were getting enough nutrients was if you grew hair on your legs. And if you did not, or it was super fine, that meant that you did not have enough micronutrients. So the first thing to go is the hair on your body. And so he was also a bariatric surgeon. So he measured the health of his patients and how well they were bouncing back, I guess, per se, based on whether they were growing hair on their legs. Because sick people will lose the hair on their legs, or their body, actually, not just their legs, but their body, and it gets finer.
That's interesting and very.
A lot of diabetics have shiny legs, that
shiny shin syndrome. The insulin just tears them up. Some things going back to the blood pressure thing, and I'll wrap this up. You can actually measure an enzyme called LPPLA2, and that will tell you if you are actually plaquing your arteries. And that enzyme, if you see that enzyme, you're in trouble because you do have the soft little plaques that are in your system that cause the cardiovascular strokes, the heart attacks and stuff like that. We will end on that very joyous note.
So if you can find like churches, add some more to that, because those scans, they ultrasound your carotids actually to find your risk,
your CAC score,
and that is super expensive. However, a couple times a year, those are usually provided at certain churches or community buildings for about $40, $50. And if you can, and they usually throw in like other tests like bone density and things. So if you can find that, and you're probably, I would say over the age of 40, you should absolutely take advantage of it.
Perfect. Well, your PSA for the day. Have a great night.